Hello, my name is Annie K. Rule, and welcome back to my channel. I hope you're doing well. I hope you're having a good week. And I wanted us to continue the conversation that we were having regarding common lab works. I know I did a part one, so I want to follow up with part two. All right, so part two discusses a urinalysis. Now, urinalysis is a test of your urine and is used to detect a range of disorders such as urinary tract infection, diabetes, and kidney disease. And it focuses also on appearance, concentration, and content of the urine. So you probably know when you go to the doctor and they ask for a urine sample. Now, sometimes they may ask for what they call a clean catch urine, and they'll give instructions then because they'll give you like a cloth to wipe. So normally for that one, you would wipe the genital area from front to back. You'd urinate, and then you'd urinate not in the container, and normally get like midstream. But if it's going to be a clean catch, they would tell you, the provider would tell you it's going to be a clean catch. But otherwise, they'll just ask you for a urine sample. But a urine sample does detect if there's urinary tract infection. It's also used to determine diabetes based on if there's glucose being spilled in the urine, and also kidney disease, because it gives an idea of the concentration in the urine and the color as well. So it does give an idea when you talk about the color of the urine. And when we say content, we're thinking about like ketones or any bacteria that's in the urine. Now, as we get to hemoglobin A1C. Now, hemoglobin A1C, let me get my pointer here. Is this the pointer? Yes. Hemoglobin A1C measures average blood sugar levels over the past 3 months and commonly used to test to diagnose prediabetes, diabetes, and diabetic management. It's also used to get a baseline of your A1C test if you're an adult over 45 years old, or if you're under 45 or overweight and have one or more risk factors for diabetes, such as type 2, like overweight, or gestational diabetes means that if you had diabetes when you were pregnant, a family history of diabetes, African American, if you have high blood pressure, or polycystic ovarian syndrome, which is also called PCOS, and that's in women. So these are conditions that your doctor may order hemoglobin A1C, and especially for those who are diabetic, it's not done on every visit. So it may be done 3 months in the beginning of treatment, and then it may be done like every 6 months if diabetes is being managed. So the time frame varies. Now, as regards to the values, if you see, for example, the first one here says normal. So a normal hemoglobin A1C blood work would be anything that's under 5.7%. Now, when in regards to pre-diabetic, and the lab work varies based on lab. So when you get your lab work, look on the range or the reference range. For pre-diabetes, it's 5.7 to 6.4%. Now, not all providers or not all guidelines will say go ahead and treat prediabetes. So you may find this pre-diabetic doctor may say to you, listen, your numbers are going up. Let's do some weight management. If you're not overweight or you're within normal weight, let's manage your diet. So less carbs, more exercise. So manage your blood pressure, manage your stress, and those can help to lower your diabetes. Now, for diabetics, if it's 6.5% or above, the doctor would probably initiate treatment based on a guideline that they're following. Some may initiate, but 6.5% or above, we consider it as diabetic for hemoglobin A1C value. Now, our third one is a thyroid panel or thyroid function test. Now, this checks how well your thyroid is producing and reacting to certain hormones. Now, the thyroid regulates bodily functions like your mood, energy level, and overall metabolism and growth. So the thyroid panel measures the TSH, which is the thyroid stimulating hormone levels in a blood sample. Now, a high TSH level, could indicate that the thyroid gland is not making enough thyroid hormones, and that may be called primary hypothyroidism. And these symptoms could include feeling cold, like just random, like not really random, but like in conditions where maybe a typical person would not feel cold. Also constipation because everything is slowing down. So in hypothyroidism, the body is functioning lower, the metabolism is lower, your energy level is lower. So just think hypo, think under. So you'll be feeling cold, constipation. The gut is not peristalsis or movement in the gut is not as a fast pace. Weight gain. It'll be harder for you to lose weight. Weight gain, slowed thought or thinking, and decreased energy. Now, a low TSH level indicates that the thyroid is producing too much hormones, and that's hyperthyroidism. Now, symptoms of hyperthyroidism can include tremors, because it's just that like you're wired, like it's just going fast and everything's just going so triggered and so fast. So you may have tremors. Palpitation, that's when your heart is beating extremely fast. Restlessness, because everything is going so fast and everything is just like it's like an electronic impulse. So everything is just going so fast. So you may feel restless because you're just going back and forth, not being able to stay still. Feeling too warm. Now metabolism is the breaking down in the body function. So if everything is going fast because it's hyperthyroidism, then you're going to feel warm. And it's like you plug in a computer, for example, or something getting a lot of energy going fed to it, it's going to get heated. Also, frequent bowel movement, because now your stomach is over functioning. Disrupted sleep, because the thoughts are racing, just everything is just so much that you're not able to stay calm for sleep. And unintentional weight loss. So, I mean, I know that thyroid symptoms can mimic other disorders. So it's important that if you have a thyroid panel done, that you talk to your doctor about this. And if the numbers are not within normal range, and be referred to an endocrinologist, and then there could be further studies done. But I would recommend at least get a thyroid panel done once a year in your annual blood work, because especially for women and just overall in this current population, is that a decrease in iodine, and iodine is a nutrient that normally is found in salt, but it helps the metabolism in the system. So a lot of people are not really using table salt that we use anymore that has iodine in it, or you're using like pink different salt and it may not have iodine. So just to have a thyroid panel at least once a year to get a baseline with your provider is strongly recommended. Alrighty. And these are my references. So I hope you are doing well. Thank you for logging in and see you soon. Have a great week and take care.